Thank you for visiting our poster on an interprofessional committee for sex education and healthy relationships for people with intellectual and developmental disabilities. Along with my co-presenters, I am a member of the committee we will discuss today. I'm Debra Ilchak, a nurse practitioner with a clinical expertise in sexual health and a clinical associate professor at Arizona State University.
My name is Fallone, and I am a faculty dental hygienist at A.T. Still University, and I work in the Advanced Care Clinic. I am also a clinical director for Special Olympics Arizona Special Smiles, and my expertise is in special care dentistry.
I'm Rachel Gallagher, and I'm a social work graduate student at the University of Albany in upstate New York. I am the intern for this committee.
My name is Gianna Zola. I'm the Health and Advocacy Senior Coordinator at Special Olympics Arizona.
So the reason for this, why this committee was formed, is people with intellectual and developmental disabilities often do not receive any education regarding sex or healthy relationships. Here in the state of Arizona, there's actually no standard curriculum for sexual health education. As we all know, there's an increased risk of sexually transmitted infections, sexual abuse, sexual and unplanned pregnancies. So we really felt this was really important. There's many barriers that exist to access evidence-based information and resources. So that's why this project and this committee was formed.
Special Olympics Arizona, also known as SOAZ, offers inclusive health programming through screenings, education, and advocacy. SOAZ understands that all people have the right to healthy and safe relationships and recognizes the lack of sexual health services for people with IDD. In an effort to make sexual health education more inclusive, SOAZ received a grant from a nonprofit organization called Arizona Family Health Partnership to create the Sex Education and Healthy Relationships Committee. This committee is an interprofessional working group.
Our committee is made up of 28 individuals, some who fall into multiple categories on this chart. Our athletes and parents come from varying backgrounds and provide firsthand experience that is integral to the development of a comprehensive curriculum. Our clinical professionals contribute experience and knowledge across a variety of clinical specialties, and our community partners and educators come from roles both within and outside of the IDD field. The committee also includes staff from varying roles within SOAZ and is not limited to only those within inclusive health. Most recently, we have developed committee work groups focused on curriculum development in 3 specific areas: boundaries and relationships, violence prevention, safety and advocacy, and clinical. Each work group is led by a consultant who is an expert in their field and comprised of committee members with varying backgrounds and experience.
In order to create comprehensive and all-inclusive trainings and resources, we have divided the project into 8 different phases. Throughout the beginning phases, we have conducted research and gathered resources, established the committee, and hosted a healthcare professional and student training. Moving forward, we will create, pilot, and disseminate an SOAZ staff training, develop, pilot, and disseminate an inclusive and comprehensive curriculum for individuals with IDD, and provide in-person educational opportunities.
There are 4 accomplishments from our first year of committee work to highlight. The committee identified various gaps in the resources available in Arizona. A needs assessment survey was conducted with SOAZ Healthy Athletes clinical directors and providers, which guided the creation and implementation of a training for health professionals and students that was attended by 64 individuals. Focus groups on sexual education needs were held with 14 SOAZ athletes. One athlete stated, "Every patient matters regardless of their status in life, medical history, disability, diagnosis. We are all sexual human beings and we all have needs. All our voices matter. We need providers to listen to their patients and know them for them."
The next steps of our project include continuing to apply for additional grant funding and spending time developing our comprehensive curriculum, as well as the training that accompanies it. We would like to thank Arizona Family Health Partnership for funding this project. If you have any questions about our project or poster, please email Gianna at specialolympicsarizona.org.